Homa Bay County was among the highest or the top affected counties to be hit by cases of malaria in the past few years. But strong efforts by community health volunteers have pushed this to the back of the minds of many residents who are now implementing various methods to curb the disease. Gina Kirori tells us more.
The basin of Lake Victoria in Homa Bay breeds a spectacular view for residents. But it is the same lake's habitat that has provided a home for mosquitoes, carrying a high number of malaria vectors. The expansive lake makes it difficult to control these vectors. At this home near the lake, a spraying exercise is underway by workers from USAID to chase away the incessant and sometimes deadly pests.
The spray campaign is done annually, because the spray done in February is able to cover the long rains and also the short rains.
Other interventions to fight malaria include the distribution of treated mosquito nets, retraining of clinical officers on how to handle severe cases of malaria, and awareness campaigns for pregnant women who are among the vulnerable groups. The group, however, faces challenges in getting the much-needed free malaria drugs, as there is only one supplier.
Malaria in pregnant women usually can easily result in severe malaria and cause adverse effects to the mother and the pregnant and the child.
In 2013, Gina Atieno was a victim of the adverse effects.
When it came a time that the blood started coming out more, the clots. So when I went to the hospital, they said that I've miscarried, so there is nothing like a baby.
Gina would suffer 3 miscarriages after that. She was reluctant to visit the clinic over fears that she would be told she had a terminal illness. But a visit from a community health volunteer who urged her to get checked would change that.
Nilipoenda hospitali, nilikuwa mimba na pia nilikuwa na malaria. Nikapewa tembe hizo, nikameza, nikatibiwa, nikapona. Sasa mimba ilikuwa tu hivyo vizuri, nilijisaidia. Nikaleta bouncing baby boy. Watu walifurahi.
The fence to keep malaria at bay in the lake region was stepped up when a vaccination drive came knocking. Noreen Kimane, a teacher, became the first mother to have her child vaccinated against malaria in Kenya.
When I was told that I was going to be given the vaccine, my child was going to be given the vaccine, at some point I had some panic because it was something new, it has never happened before. But I consulted my husband, who therefore told me that there's nothing bad with it.
Since the rollout of these interventions, the uptake of the vaccine among children under 2 years is approximately 67%.
During the COVID-19 pandemic, fewer pregnant women have visited health facilities over fears of exposing them and their children to the virus. Health workers are, however, calling on them to make the trip to ensure that they are safeguarded.
And the joy of a mother is to see that a child is protected from any other disease, and more so malaria.
Gina Kirori, NTV.